Wow, I can say when the idea started, it wasn't really openly received because the young people were like, why this? Like, why do you want to listen to our stories? Why should I talk to another young person? But as they started like slowly buying into that idea, I can feel like it has reached a really, really large number of young people, even outside Kibera.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen, and I'll be your host. Let's roll.
Greetings and welcome to another episode of the African NCD Champions podcast, where we meet and interact with people working in the non-communicable diseases space across Africa, creating change, sharing their stories and impact. In this mini-series, we are looking at the Young Health Program, a program by Plan International Kenya, and with funding from AstraZeneca, working to improve policy, access, and literacy for non-communicable diseases and sexual and reproductive health across the country. In Kenya, the program has been running for 10 years now in Kibera and Mathare, and today we'll be talking to one of the key players in the community who have been working with this program. And without further ado, Marlene, give us an introduction to yourself, what you do, and how we got to be here.
So hi everyone, my beautiful name is Marlene Kerera. I'm a lead peer educator under the YHP program in Kibra particularly, and I work in an area called Soweto East. So I have been a peer educator for close to 10 years now. I feel I started when I was a very young girl and I can't say I am so young anymore, but it has been such an amazing journey just working with my community and being part of the transformative journey and just seeing my people choose healthier choices, make healthier choices in life. That has really been good for me, I can say so. Yeah,
as a peer educator, you are known for championing mental health. So talk to us about what you did inside the program and what it has done to date.
Oh yeah, that's very true. I feel like mental health is really close to my heart, and I can say it goes hand in hand with NCDs, and it started from a personal journey. Back when I was in high school, unfortunately, I lost both my parents to NCDs, and I felt I didn't have a community around me to help me understand my emotions at that particular time. My siblings were similarly going through the same experience, so I wouldn't go to talk to them. And there weren't any programs or opportunities around me to find help. So when Young Health program came along and an opportunity, an avenue came up for discussions around mental health, then it took me back to Marlene in high school, who didn't have anyone to talk to. And being that I have grown up in Kibra. Kibra is an informal settlement, so mental health is not a priority. Like you have to go on with life. No one has time to be talking about emotions and all that. So, and I'm someone that likes listening to podcasts a lot. So I was listening to a podcast. It's called Legally Clueless by Adele. And there was this lady who was talking about grief and how she went through losing the mother and all that. And I thought about how I'd like borrow that and bring that into the program, hence the birth of the Mental Health Cafe. It's just like young people coming together and just talking about their problems to each other. For example, I come to you, Steve, and I'm like, at this particular time, I'm going through this. Have you ever gone through the same thing, and how did you go about it? And if in that conversation it's something that needs further support, then as Young Health Program, we are able to offer such support. And also, I read books a lot, and there's this particular book. It's called Ikigai. And it's just about how stress ages you. You'd go to Kibra and you'd meet a 25-year-old and they'll tell you they're 25.
And you'll be shocked.
You're like, oh, 25. Oh, okay. You can't outwardly like show your surprise, but then you'd think they're clocking 30 or even more than 30 years old, but it's just because of the stresses of life. And then in this particular book, there's a place where Moai, it's like a community. They talk about Moai, where people with similar interests come together and they talk about what is affecting them, if it's harvest, how is the harvest, how are they able to support each other. And that is also brought into the Mental Health Cafe because we are young people. We might be going through similar problems, and how can we get ourselves through that? And yeah, so that is Mental Health Cafe for you.
I see. So how big has your reach been in the ground?
Wow, I can say when the idea started, it wasn't really openly received because the young people were like, why this? Like, why do you want to listen to our stories? Why should I talk to another young person? But as they started like slowly buying into that idea, I can feel like it has reached a really, really large number of young people, even outside Kibera. I remember there's this particular time young people from the university actually came and they wanted to like be part of that conversation and also listen to situations or stories from Kibra that young people face, because we might be both young, but maybe you coming from a different place, you might your experiences might be a little bit different. So just that exchange program spurred a lot of conversations, and I can say the reach has been really large, and I'm hoping that it even goes beyond just Kibra. Yes.
I see. So talking about mental health, which is a very big challenge right now in the country and even globally, and especially in Kibra where it's not a priority and nobody really cares about mental health per se, would you say there are other avenues that have worked with you to ensure that if you find someone that really needs help, that you are able to refer them or recommend them to the other places?
Yeah, I can say so because previously mental health was not a priority. But as the world realizes that a lot of even just our day-to-day activities bank on how you're feeling. You can wake up in the morning and you're just like, your body does not even want to get out of the bed. And being that people now are starting to understand the world is becoming kinder and more programs and opportunities are coming about where young people are able to access mental health support and all that. Like in Kibra, we've worked closely with Nivishe, which is a mental health organization that offers support, and others are coming about like the Mental Health 360 and all that. So I can say that now that there's deliberate efforts being put towards mental health, then referral systems and support are also coming about.
Second to last question, what has been your biggest highlight as a champion for mental health within the Young Health program?
Personally, I'd start with myself. I don't know if that is
Yes. No.
because just being able to realize that you're not okay, I think is an achievement in itself. Because most of the time we hide behind our titles, we hide behind our work and all that, and we fail to realize that there's an aspect of us that is failing or that is just slowing us down. So the fact that I personally realized that at some point in my life I needed support has helped me also be able to realize when people around me need the same support. And I remember there's this particular time I was in the office and this lady came in and she was crying. So I gave her a moment or two to just sit in with her feelings first. And then I was like, are you able to share what you're going through? And she was like, yeah, I've just found out I'm pregnant. I've talked to my baby daddy and he doesn't want anything to do with the child. I don't have parents. I don't have any sort of like financial backup. So it's really stressing me out and I don't want to like chuck or remove this pregnancy. So like, how can you support me? And first I was very glad that she was able to open up, because opening up is like a step towards being able to receive support. And with her consent, I was able to share her story with the team, and people came together and we were able to fundraise. Those who had like financial support came through, those who had like baby clothes came through. We were able to like find a facility for her to go for her NC and all that. And I feel like it was from her being comfortable to share with me her story, for whatever reason. It might be because she felt like I'm a peer, or because she felt like it was a safe space for her. Though nowadays the word safe space, quote unquote, has been misused and all that. But I felt that at that particular time, that was a very big highlight for me as a mental health champion. And now when I meet her and I see her baby and she's just happy, I also feel happy. Yeah,
very nice to see. That's a very touching story of actual results from some of the work that you've done. So if you had to do it again, what did you do different?
Yeah, I was thinking about that, and I felt that maybe we can even incorporate games in the mental health cafe. As Marlene and Steve are conversing about the mental health, they may be doing a game of Scrabble, there's Jenga there, so your brain is engaged as you're also talking about your problems. So when you get from that space, you've learned a new game, because most of the people from where I come from, things like Jenga or Scrabble or chess, not really in that.
It's not the games that we are doing here.
No, we do more of like, I don't know, Ludo,
snakes and ladders and things like that.
Yeah, and Ludo is just usually customized, like a board is drawn and you have to pay for you to play. But if you're able to like get that in a place where first of all it's safe, you don't have to pay for the games, and you're also able to talk about your life and your situations and get support if possible, then it will be a plus.
Yeah, again, well, thank you very much for coming through and sharing some of those key insights. We'll be having a part 2 very shortly, where we'll be talking a little bit more about actual experiences on the ground and some more details on your work in there. But for everyone watching, thank you very much for joining us in this first part, and we'll see you on the next one.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storelink and at NCD Champions. See you on the next one.